How to remove a menstrual cup. A menstrual cup is a reusable alternative to pads or tampons. It's a small funnel shaped flexible cup typically made of high quality medical grade silicone or latex rubber that you wear inside the vagina to collect the menstrual blood during your period. Menstrual cups come with the capability to hold more blood than other forms of sanitary products, and depending on your menstrual flow, you can wear the menstrual cup for up to 12 hours. You can simply empty the cup, rinse it, and insert it again. Menstrual cup is usually available in three different sizes: small, medium, and large. For teens and virgins, smaller cups are best because these cups are easier to insert and handle for first timers. There is no minimum age for using a menstrual cup. Before using your cup for the first time, you should always read the instruction manual that comes with it. You can wear the menstrual cup for 8 to 12 hours without worrying about leakage. You must always remove the cup without exceeding the 12-hour mark to avoid an increased risk for toxic shock syndrome. When removing the menstrual cup, you need to be very careful. Don't just grab and pull by the stem, as the cup creates a airtight seal inside the vaginal canal. You need to break that seal before you pull it out. Before taking out your menstrual cup, you need to follow these steps. Wash your hands with soap and water so that you aren't touching your privates with dirty hands and risking an infection. Find a comfortable position. Sit or squat with your legs apart. This pushes the cup down. Now gently part your outer labia with your left hand and insert your right hand thumb and index finger inside your vagina and reach for the stem. Some people find it hard to feel the cup or stem. Do not worry. A menstrual cup cannot get lost in the vagina. If you cannot feel the cup, just breathe and use your pelvic floor muscles to help push the cup down. Now gently pinch or squeeze the base of the cup to release the airtight seal. Otherwise, it cannot only get messy and feel uncomfortable. If you have an intrauterine device, you can risk dislodging it in the process. So take your time and don't be forceful with it. Once the suction is released between the cup and vaginal walls, by gripping the base, you can slowly pull it out. Try to keep the cup upright to avoid spilling any blood. Be sure to maintain a good grip on your cup when removing it over the toilet so as not to let it fall into the toilet. To avoid dropping your menstrual cup in the toilet, you can remove and insert it off to the side or front of the toilet rather than when sitting on the toilet. If you are sitting on the toilet, make sure you use two hands, one to remove the cup and the other to catch the cup if it is slippery. Sometimes your cup tends to move lower when you poop. It's a good idea to remove your cup prior to going to the toilet. Do not reuse a cup that had been dropped in the toilet. If you choose to disinfect your cup after dropping it in the toilet, be sure to boil it for 10 to 20 minutes to kill germs. How do you clean it? In general, there are two types of cleaning: the cleaning you do in between insertions and the cleaning you do in between cycles. Cleaning in between insertions. Once the cup is out, empty it into the sink or toilet and flush. Rinse it thoroughly with cold water and then with warm water and insert again. If you are unable to wash your cup in between uses, simply empty and wipe it out with some clean toilet paper. Just be sure that the little air holes at the top of the cup are clear, as these are what help create the suction seal when the cup is inside the vagina. And be sure to remove any pieces of toilet paper that may have stuck to the cup before you reinsert it. When water is available again, wash the cup well. Depending on the menstrual flow, the cup should be emptied 2 to 5 times a day or every 6 to 8 hours to reduce the risk of vaginal irritation and leakage. Cleaning in between cycles. Once your menstrual cycle is over, you need to wash your cup by sterilizing it in boiling water for at least 5 to 10 minutes. Make sure the vessel is deep and there is enough water to float the cup. And don't forget to check the info on your cup to see whether it warns against boiling. Bacteria can grow on your cup if you don't clean it properly. Make sure you always soak and scrub your cup at least once a cycle, such as before storing your cup for next month. Many companies sell special soaps and cleaning wipes along with cups. But many women like to sterilize their cups using sterilization tablets, hydrogen peroxide, or bleach. Remember, if you wash your menstrual cup with unsuitable products, you can damage the cup and your health. The pH levels of soap you should use for your cup should be at 3.5 to 5.5 because the vagina has a low pH level. Basic soaps disturb the natural acidity of the vagina, and disposable menstrual cups need to be thrown away after each use. Sterilization and proper storage of the cup for the next cycle is an equally important process. Don't store your cup in a sealed container with no airflow. Always store it in the pouch that comes with the menstrual cup in a clean, cool, and dry place. Store the cup only after washing and drying it, and be sure to re-sterilize it before your next cycle. One of the questions we hear quite often from women is, can a virgin use a menstrual cup? Can inserting a menstrual cup break the hymen? All over the world, people have different ideas and opinions about virginity and the hymen. They vary a lot depending on the country, culture, or religion. To start with, let's make sure what it means to be a virgin. By definition, a virgin is someone who has not had sexual intercourse. Hymen is a small, thin piece of tissue that some people have around their vaginal opening. Not every female is born with a hymen, and hymen does not cover the entire vaginal opening. The hymen actually comes in various forms, and all of them have openings of varying degrees. The hymen is largely misunderstood not only by men but also women all over the world. Having a hymen or losing it doesn't make any difference to a person's health. But many cultures view the hymen as an indication of virginity and believe that it remains intact until a person has sexual intercourse. The hymen can stretch or tear with the simplest of actions or physical activities like cycling, swimming, dancing, horse riding. When inserting a tampon's cup or fingers in your vagina, the hymen can be easily broken. If you want to use a menstrual cup, you need to insert it into your vagina. Inserting a menstrual cup is not a sexual intercourse. When you insert a cup, there is a very high chance that you might stretch open or break your hymen. Using a menstrual cup does not mean that a woman has lost her virginity, and the absence of a hymen isn't an indicator of sexual activity. If you have never been involved in a penetrative sex and using a cup for the first time, opt for a smaller, softer cup. Menstrual cups are safe to use as long as a person follows the safety guidelines. Menstrual cups come in a variety of shapes and sizes, and finding the right fit is key. Using menstrual cups can be challenging at first, so you may need to try different techniques to make it work for you. If you are still unsure, you can talk with your gynecologist about your options, and she can help you determine which menstrual cup would be right for you. If you like this video, please give it a like, share it with your friends, and don't forget to click the subscribe button to enjoy more such videos. Thanks a lot for watching this video. Bye bye.